Hi, I'm Jacob Granke. I'm here with Shara, and we're going to talk about the social workers. What is a social worker?
I'm really glad you asked that question, Jake, because a lot of people hear the term social worker and they think some negative things, and so I'd love to tell you what I do in the clinic. My role is to provide an extra level of support services to our patients and families, and I do that in a lot of different ways because every family is different. But what we find with our kids that have inflammatory bowel disease is a lot of times they have suddenly gotten this disease and their life is kind of turned upside down, and so we look at every resource, every support that we can offer to try to de-stress their lives in a time of dealing with chronic illness.
What are some topics you can help patients/families with?
For some of our patients, they need a level of support that includes just getting to visits. They have a lot of barriers that keep them from getting here, like transportation or the cost of gas. And we look at things like Medicaid transportation, other resources to help them get here so their child can get the treatment that they need. For some of our families, they need help with their school. Their school doesn't really understand, is this just a tummy ache or what's really going on? And so I communicate with the school, provide documentation, and just help the school understand what our kids are dealing with. And then sometimes we need other community resources like counseling referrals or other types of support that would help them. And so I look for those resources and just try to find the things that will best help our families cope with this time in their life.
What is the 504 plan?
A 504 plan is a very important document to our patients. It's actually a document that was created to protect kids that have a chronic illness or a disability from being penalized in their academic setting. So what we do is we provide a letter to the school that our patients attend, and we explain what their diagnosis is and what are some modifications or accommodations that they might need because of that diagnosis. And that helps the school do what they can to best meet the academic needs of the kids, and also understand that our kids are going to miss some school, but it's for a good reason. And so we can support them in that way so the school has the clear communication, and that again helps our patients and families lower their stress level as they're dealing with the illness.
Do you have support groups for IBD patients?
We do have a group of parents that want to offer support to our patients who have IBD. We have found that by working with the parents instead of the patients, that works best in the pediatric setting because our patients have so many commitments already with trying to get here to appointments and managing school and their other areas of life, that we found that if our parents can communicate with one another, they can find out how they can best support their children through this time. And the way we do that is when we have a new diagnosis of one of our patients that has Crohn's or ulcerative colitis, we come over to the hospital and we bring them a gift box, and that has been prepared by this group of parents and their kids for our new diagnoses. And they open the box and they find that there's a letter there that's written specifically to their parents, and it gives them an email address that those parents can then choose to contact other parents who have walked this same journey of inflammatory bowel disease, and they can ask those questions that parents can best answer because they've been through it.